Well, what's an atlas? You know what an atlas is? Right. To most people, it's a map of the world, isn't it?
Back to school, we're talking about those things. But there's also a bone in the neck by that name. If the atlas is out of place even just a little bit, it can make a tremendous difference in the way we feel.
It sure can. And that was the case for Jeanne Kessler. Dr. Drew Drummond returns from the Spinal Balance Health Center. Good to see both of you this morning.
Welcome back. Jeanne, it's nice to meet you.
Jeanne, yes, nice to meet you. What symptoms were you seeing when all this was coming to head?
Originally, I was just in a small car accident, and I had neck pain, and was given muscle relaxants and just waiting. And then my husband actually was doing some research, and he found Dr. Drummond. And so we decided to give it a try.
Give it a shot, because it's not surgery, right? It's non-invasive.
Right.
What did you notice right away?
Well, immediately my posture was improved, and I felt like lighter, and it was easier. You know how people always say, stand up straight, stand up straight? And it was hard. I mean, I was always fighting to do that. And immediately, that just became effortless.
Did it affect your day-to-day life, and how bad did it? Were there certain things, certain tasks you couldn't do?
Well, no, there weren't like tasks that I couldn't do. I did have neck pain, and I wouldn't do things as long. Even just looking at the computer and things you would normally do, I would just quit and say, oh, I can't do that now, and stop.
Did you notice all of that started to change? Like not just after that first treatment, but progressively as you continued to go back?
And it was progressive, because the neck pain, it was kind of, the treatments were subtle. And so that didn't diminish immediately, but then, you know, I would go 2 times a week initially, and it just began to get better and better, you know, as time went by.
What was it, Dr. Drummond, that you saw with her?
She had a misalignment at the top of her neck. The bone, the atlas that you all were talking about, is more easily misaligned than most of the bones of the spine. And when that happens, it starts interfering with some of the very basic functions of the body. And one of the functions that's interfered with is posture. So when the car accident, we presume, had something to do with it, when that bone moved out of alignment, it started interfering with the nerves at the top of the neck, and it caused one side of her back to pull more tightly than the other, just threw her whole structure off.
And that's when she was saying she was fighting it, right? But that's what you're saying, when your body's working in one way.
She wants
and
to get back upright, but she can't. I mean, it's impossible when your muscles are not pulling you into an even posture. You're just compensating.
And when you talk about that atlas, it can, as we see in this demonstration, this virtual this deal right here, it can affect all kinds of things, because you can see all the nerves that run from the top of the neck.
Your body is controlled by 2 basic mechanisms, either chemical reactions or nerve impulses. That's all you got. So when this nervous system that's being showed here is interfered with, there's a breakdown in the way the brain communicates with the body, and the little bone that we're talking about is right at the base of the skull. So any message that the brain is sending to the body or vice versa ends up being, has the potential of being interfered with. So with her, the neck pain got better, but then she also went back to the doctor about a month later, and she found out that her thyroid function, that she had been on medication for 20 years, and he's reducing now the medication because her thyroid's working better. She had high blood pressure, and that's going back down toward normal.
What was it about that realignment that affected those 2 things?
Well, when the muscles are pulling unevenly on the spinal column, it is pulled out of its normal position, then it starts interfering with various nerve roots throughout the entire spine, or other nerves at the top of the neck besides just posture. So there becomes this breakdown in normal physiology, and typically what people will do is go to a doctor for a thyroid problem or for high blood pressure or for a neck pain, and they'll be given medication that just kind of pushes those symptoms back under the surface without taking care of the underlying problem. And we're just simply going back to the original issue that then tumbled into thyroid issues and high blood pressure.
The nerves run to all kinds of organs throughout your body.
And Jeanne, you had to be floored when your doctor starts talking about reducing these medications.
Yes, he actually said that to me before the first treatment. He said, watch your medications, they could be going down. And I just thought, yeah, okay.
You were skeptical.
Very, yes. And then, you know, that began to happen. So,
you were glad he was right.
Yes.
In that case.
I'm sure it varies differently from patient to patient, but how quickly can people see
it is different. Typically, within the first couple weeks, if not after the first visit, people will see improvement. Sometimes very dramatic, sometimes it's a little more subtle. She was really over about a 2-week period, really was to where she could say, yes, this is absolutely better. But I've had some people with very serious problems that have had, 3 back surgeries and a lot of therapy, and it's been going on for 50 years. And then they might take a month or 2 before they start noticing things. So there isn't like a cookbook on this. It depends on the person and the issue. But very seldom, if there's issues with, especially the way people just distribute the forces of gravity through their framework, very seldomly is it not because of a posture imbalance that's coming from the atlas, at least partially.
It's remarkable, and to see these changes, Jeanne, you've just got to be over the moon.
I am.
Yeah.
I was so excited when my daughter came back from school for the summer. I said, you have to go see Dr. Drummond. She had some migraines and stuff, off at college. And
Well, and you see patients of all ages, from babies, teens, adults. And in fact, he brings us a special offer in case Jeanne's story is resonating with you and you'd like to give NUCCA Care a try. The first 15 people who call his office this morning and mention the morning blend, you'll receive all of that, and you can read it on the screen for just $50. So let's show you the phone number so you can make that call. It's 452-3400, and then online to learn more about NUCCA and Dr. Drummond's specialty, it's spinalbalancehc.com.
Jeanne, thanks for stopping in. Glad you're feeling a lot better.
Thank you.
Doctor, good to see you.
Good to hear.
Have a good week.
Several of Dr. Drummond's patients have shared their stories with us over the years. For those clips, go to OmahaMorningBlend.com. In the topic bar, type Spinal Balance. It's that easy.
So what happens when you ask parents and kids kind of about the same things?
Find out when the conversation turns to a new school year, just starting today for many people. It's coming up next.